with that, I'm thrilled to introduce our next speaker, Dr. Douglas Paauw. Dr. Paauw is a physician at the General Internal Medicine and Virology Clinics at UW Medical Center Roosevelt, and he's also UW Professor of General Internal Medicine. He's also the director of the UW Medical Student Program, and I know he will inspire us today with his talk today. Thank you so much, Dr. Paauw.
Thanks, Mayor. Everybody able to see everything?
Yes.
Great. Get this started. Well, I love having the chance to talk to all of you as many of you are starting your careers, and I commend you and am so impressed that you are interested in careers and serving others and making a big difference in the healthcare field. I want to take this time really to talk more on a big picture basis of what do we do in this whole journey? Why are we doing it? And what are the things that are going to help you sustain you as you go through? Because it's a long road, and there is room for everybody in medicine and many different endeavors. The first thing I just wanted to focus on is make sure that you're making this choice for yourself, that this resonates with what you're excited about, who you are, and how you do things, that it's such a long journey that it really has to be because you want to do it, not for anybody else, not because anybody else thinks that you're talented and could be great in the medical profession, not because it's an honorable profession or it's a stable profession or any of those things. I think it really has to come from within your heart, because the journey is a long one and it's a deeply rewarding one if it is the right thing for you to do. So I had a bit of a journey to get to deciding to become a doctor. And for when I was very young, I thought that's what I was going to do. And then for a while, I went away from it and came back to it because I kind of realized this is where I'm going to be happiest. I took a foray where I thought it'd be a good idea to study freshwater lakes, and I did an internship, and it was cold and there weren't people around, and I was rooting around through mud samples at the bottom of lakes, and I just thought, what an awful thing. I really don't like this, and I had to rethink what I wanted to do. And I went back to what has always excited me and made me so excited, and it was trying to reach out to others, help other people, and all the excitement of how the body works, and I think now how medical systems work. There are a lot of different things to be excited about, but for me, I had my own journey where I had to go somewhere else and figure out what I didn't want to do to figure out what I did want to do. The next thing I just wanted to touch on to help you all as you start to think through what you're going to do is you really, to become somebody in the medical profession, you have to be good at making mistakes. You have to be okay with it, and you have to be confident enough in the person you are to realize that none of us are perfect, and we're going to goof up. We're going to do things that don't work out, and to realize that that isn't a referendum on who we are as people or how smart we are or how good we are, that we learn from making mistakes. And one of the things that's concerned me in the last 10, 15 years in medical education is I've seen so much more fear in learners of being found that they've made a mistake. And I'm not sure where that comes from, but I don't think I could have ever become the doctor that I am if I hadn't been okay with trying and in trying, recognizing that I would goof up and I'd make mistakes. And I learn so much more from when I do something wrong than when I do something right. I never forget when I mess something up because I never want to do it again, but it's such a fertile ground for learning. And I want all of you to have enough confidence in yourself that you're going to try, that you're going to raise your hand and you're going to say something, or you're going to volunteer to do something and you're going to try it. And you're going to take how it turned out to be part of your learning experience. Because those who try are going to do a lot more. They're going to be a lot more, make more difference in the world than those who are so worried that they have to be perfect before they try anything. To borrow the hockey theme from the last speaker, Wayne Gretzky once said, a famous hockey player, you score no goals on the shots you don't take, or 100% of the time you won't score on the shots you don't take. And And, I think that the whole idea of worth a shot is really important. We take a shot, we try, we actually say something, we have enough confidence that we're gonna show what we're thinking and we're going to share it with others. And then if we need to learn from it, people will be around to help us to learn from it. So please do not be scared to make mistakes. We want to do the best we can, but it is not human to not make mistakes. So that was probably the single most important lesson I learned as I was in training and as I started this journey is go for it. Don't hide in the background, worried that you're going to look silly if you say something that isn't right or say something that somebody's reaction is kind of like, well, that's obvious. Most of the people in medical education are very gracious, and we want to hear what people have to say. Another pearl, an important thing that I think is so important that I've learned along the way is remember you're running a marathon and not a sprint. That you are going to be in this endeavor for your career, your life, and that includes schooling when you're in high school and college to get the type of background that helps you in a field in the medical profession. If you go on to graduate school, if you go into nursing school, you go into school to become a physical therapy, you go to medical school, you go to school to become a physician's assistant, nurse practitioner, many different things. You become a researcher and get a PhD. All of that takes a lot of time, and we really have to pace ourselves. We have to realize that we're in it for the long haul, and that it's not about peaking when we are 18 years old or 20 years old. We're always going to be learning, and we're always going to be becoming the person we want to become. And so sometimes I think people are so worried about looking so good and achieving so early in life and just pushing that they get tired. And remember, it's a long journey. So pace yourself. Just like if you were running a marathon, you would not be sprinting the first 5 miles. You might try to sprint the last quarter mile or half mile of a marathon because you know there's the end in sight. But in our careers in medicine, we never really focus on the end in sight. We focus on the journey. So do pace yourself, take care of yourselves, make sure and check in regularly that you're enjoying what you're doing, you're enjoying your career decisions, you're enjoying your life, you're enjoying the people around you. Another thing I think we all need to remember are people are the most important resource. It's not MRI scanners, it's not technology, it's not the most beautiful hospital. It's the people that are in it, because all of this is done by people. And I think this is really important to remember as we start to go and interface more with artificial intelligence. People are a lot smarter than artificial intelligence. I was playing around with something last night with my family. We were giving questions to ChatGPT, and I was stunned by the number of crazy errors that there were in it. And everything sounded really good, but a lot of it was bullshit. A lot of it was just junk. And people have that innate ability to understand everybody else around them, the needs of everybody around them. It's not just about being really smart and figuring everything out and looking like the smartest person on the block. It's about who are the people around you? Who are your coworkers? Who are the people you're teaching? Who are the people you're learning from? What are their journeys? What are they as people? And interfacing in a really, really important system. So remember that people are the most important resource, and your relationships with other people are going to make you a successful person in the medical profession. Always recognizing their hard work, always recognizing how important they are to what you become. And so care for yourself first and foremost, and care for all the people your lives touch, whether it be your family, your coworkers, your students, your mentors. All of those things are really, really important. And there is nothing that will ever be more important than that. I love this Maya Angelou quote. I think it's such a good one. I've learned people will forget what you said, people will forget what you did, but they will never forget how you made them feel. And that is so true, that 20, 30, 40 years down the road, as I look back at the people who taught me, I remember mostly not the facts they taught me. I remember how they encouraged me and made me feel like I belonged, like I was the type of person who could be a good doctor, that I could make a difference someday. And they did it through teaching me facts. They did it through modeling professional behavior and modeling compassion. They did it through introducing me to things I needed to learn to become who I would become. But what I really remember down the road is, how did I feel around them? Did I feel like I was able to really put my best foot forward? Did I feel that they would encourage me no matter what I said or did? And so remember that as you work with people, that you're always trying to set up an environment where people can feel that they can learn, that they can feel that they can become their best version of themselves. And all of you are going to do some kind of leadership in your life. You're going to teach other people, you're going to start companies, you're going to be doctors, nurses, you're going to do a lot of different things where you're going to show important leadership roles. And the key thing about being a leader is the way you treat people and the way that you make those who work with you and that you supervise feel empowered to be the best version of themselves. You know, we really are only as good as all the people around us. It's not that some people do a great job, some people struggle. No, we have to help everybody, including the person who's struggling, become the best version of themselves. Another thing that I quickly learned in my career was this very important thing is happiness, whoops, I'm going to go back on that. Happiness is tied to when outcomes are greater than your expectations. When we have so much anticipation of something in the future and we build it up so much, we sometimes make it so big a deal that it will be impossible for anything to turn out to match our expectations. And that leads to disappointment. Disappointment is when our expectations are greater than our outcomes. It took me a while to realize this, but as I reflect back on how the beginning of my journey, when I went into medical school, I knew it was going to be hard. I knew I was going to be studying really hard. I knew that I wouldn't have as much free time as I had before medical school. But I was aware of that. My expectations were that I was going to learn what I needed to be to become a good doctor, that I had this great dream of getting those skills so I could be the person I wanted to be. But I knew it was going to be really, really long hours and hard. When I got to medical school, I was pleasantly surprised at all the support I got. I did have a little bit of time off here and there. I had time to spend with friends and family, but I was ready for something much harder than that. So I was overjoyed by my experience because I had set myself up for something really, really difficult. And when it came out a little less difficult than I thought, I was very, very happy. The same thing happened in residency. I felt like everybody told me we got one day off a month, that I was going to be working anywhere from 90 to 110 hours a week, that I had to be prepared, that I wouldn't see much of my family, that I couldn't really continue a lot of my outside interests. And I went, I guess if I have to do that to become a doctor, I will. Not that I wanted to. And again, I was remarkably pleasantly surprised when my very first resident gave me 4 days off my first month. He took over a lot of my work to take care of me. And I continued to find incredible people to support me and make sure that I was taken care of. And so my happiness was sky high because my expectation was something that was much harder than what I actually got. So I do this exercise all the time when I start anything new. I think, what is the hardest thing that I could handle here? And I prepare myself for that. And it's always much, much better than that. So my outcomes are always better than my expectations. And I think it's so important to think a little bit about that, about prepare yourself for the hardest thing you may face, because life will then give you a lot of things a lot less hard than what you're expecting. I love this Albert Einstein quote: "A calm and modest life brings more happiness than the pursuit of success combined with constant restlessness." It's hard entering a medical profession. It really is, because very early in life, we are trying to get involved in a bunch of things that might prepare us to be the best version of ourselves so that we can do really well when we enter this medical profession. But I am concerned about how hard people are starting to work so early in life, that we need calm. We need to be able to accept our youth as we're growing. We need to have time with reflection within ourselves. We need to spend time with our parents. We need to spend time with our relatives and friends, because they won't always be there. And we need to soak that in and become the person we want to be, and not always have it be career driven and focused on what I'm going to become. And I think this Albert Einstein quote really hits that. It talks about a calm and modest life bringing happiness, and that sometimes we put so much anxiety about how is life going to unfold for us? Have I done enough to be successful, that we miss the journey? So yes, we're going to have to work hard to get in careers in medicine, but we really need to take care of ourselves first and foremost. And we need to treasure those relationships that are around us as we make that journey. This is another wonderful quote that I try to live by. I have never let my schooling interfere with my education. And what's meant by that, and what Mark Twain meant when Mark Twain said this, was sometimes we make the mistake of thinking we know where our education is coming from. I run into this all the time with my third-year medical students. Sometimes the students are obsessed with studying for the final exam and doing lots of practice questions and working so hard on this small little finite area where they can master. But learning is not something you're going to ever master. You're going to become good at things. You're going to have multiple opportunities to try things and become better and better at it. But so much of learning is that conversation with a patient when they tell you their life's journey. So much of learning is recognizing that you made a choice, and maybe your resident made a choice and it didn't turn out well. But what was it about that choice that didn't turn out so well? How do I become smart in all that? It's not always about studying to do well on an exam. And so being able to live in the moment, really understand where people are coming from, where your education's coming from. It may be that you learn the most from somebody who really wasn't officially your teacher. It might be the person that's cleaning the room for a patient, and you get to hear a little bit about their journey in life and understand how they've been able to serve patients in a role that maybe you would never see yourself serving patients. So be open to how you learn, and try to stay away from standard things like, how do I do the very best on a standardized test? We want people to succeed there, but don't let it get in the way of learning what you really need to learn. I will finish with my own quote, and this is something I believe strongly in. Do not spend energy trying to look good. Spend your life trying to be good. There is a big difference between trying to make the outside world look at you and say, wow, I'm impressed, versus doing the hard work of becoming the good person you want to be. Because I will tell you, if you work on yourself and become the best version of yourself, you will shine like the brightest light. If you're working more on, how do I look good in this minute? How do I impress this person right here and now? That might work for a few minutes, but it's at the cost of becoming the best person you can be. I will stop there, and I am happy to handle any questions or comments people want if we have a few minutes for that.
Yeah, thank you so much, Dr. Paauw. This was a really great presentation. These are really invaluable pearls of wisdom from a career in medicine. And I think that especially these quotes were so inspiring and really valuable life lessons in general. So thank you so much for that.
Yeah, it was really touching.
So Dr. Paauw, what has been an important takeaway point from the pandemic, specifically for physicians, and how do you think that's redefined what it really means to be a physician or someone in the medical profession?
That's a wonderful question. So the pandemic shook everybody in the world to their core, and it did the same thing in medicine. Everything from losing patients to COVID, people that you didn't think were going to die in the near future, to suddenly we weren't able to see our patients the same way we normally see them. We see them behind masks. So for a while, people wouldn't come into clinic. We had to do it via telemedicine, and we had to quickly adapt on the fly. The other thing is a sense of community. People were separated. We didn't have that community of everybody being together. We were meeting on Zoom. We were meeting in other ways. There weren't a lot of hugs there. Everybody was socially distancing. So what I think it taught me is everything changes. Everything changes in medicine. We didn't expect that we would ever have anything quite like this, and we all adapted, and people adapted very, very, very well. But what it taught me more than anything is you can't count on tomorrow. You have to get the most out of today. And during the pandemic, we found different ways to connect with people. We found different ways to learn. We found different ways to take care of our patients. We found different ways to enjoy our life, even if it was opposite what we've been doing before. So the bottom line is flexibility. And in medical profession, you have to be flexible.
Yeah, thanks so much, Dr. Paauw. I think for sure we learned and gained so much out of the pandemic, even if there was a lot of that social isolation. And I think that's just so important to keep in mind. So thank you so much, Dr. Paauw, for this presentation. And I know that this will go a long way in inspiring the next generation of young medical professionals. So I would now like to hand it over to Louise to introduce our next speaker, Dr. Taniguchi.